Good day, class. In the previous videos, we have studied some principles of acupuncture and moxibustion. From this video, we are going to discuss some characteristics in the Sheng differentiation. More specifically, the characteristics of Sheng differentiation in acupuncture and moxibustion treatments, because these characteristics are slightly different from the herbal medicine. Although we use similar or actually the same differentiation methods, but in acupuncture and moxibustion, we focus on some differentiation methods. These key characteristics will assist us in future when we see a patient, where to start and what aspects we need to consider. For example, a patient comes to you with fever, cough, severe cough, and loss of voice, sore throats, constipation. This patient have high blood pressure, high blood sugar. The reading of the blood sugar is fasting 10.2. The blood pressure is 150/90. When this patient comes to you, how do you treat this patient? What do you want to treat? This patient got the fever, the sore throats. In the meantime, this patient got high blood pressure. The blood sugar is also high. So what to treat first? Do you want to treat all of them together, or do you want to focus on some aspects and then treat the other aspects in a later stage? So all these different aspects you need to consider. Firstly, we need to identify the nature of the diseases. The nature of the diseases mainly refers to the 8 principles: heat or cold, excess or deficiency, superficial or internal, yin or yang. So the 8 principles differentiation method. These different categories from the 8 principles are the direction that we emphasized in the previous videos. These are the key principles that we study in the principles of the treatments. We need to identify clearly the nature of the diseases from the 8 principles. As we mentioned in the diagnostics, the 8 principles actually cannot help you to locate the disease location, but it will help you to have a general idea where the disease or what the nature of the disease is from the 8 principles point of view. Apart from the 8 principles, we still have the 脏腑 organs differentiation, the qi and blood differentiation. And all these differentiation, sometimes we need to consider to help us to locate where the disease is. Apart from these differentiation methods, nowadays we have the modern technique such as the ultrasound, the X-ray, the blood test. In some situations, we also need to employ all these different kinds of tests to ensure or to safeguard your diagnosis and the practice. For example, a patient suffers from headache and dizziness, headache, have high, the blood pressure is normal, and you identify the syndrome from the 8 principles. This is a deficiency syndrome with wind heat. But this patient, after the treatments for a few weeks or even a few months treatments, the headache still comes and goes. And sometimes the headache becomes very severe, even can affect the sleeping. In this situation, apart from the syndrome differentiation, we also need to be careful of the physical diseases. So sometimes, especially after long-term treatment, the patient didn't see significant improvement. We need to send the patient for the for the examinations such as CT or MRI. This can help you to exclude the tumor in the brain, because there are many other factors that may result in headache, especially in the severe headache. We need to double check some examination or blood tests, such as the increased pressures in the brain. All these may potentially cause the headache. Sometimes after your treatments, the headache is relieved, but if there's some potential disease and then you ignore the disease, you will cause further damage in future. Sometimes we can prevent if you can diagnose correctly. So the early diagnosis, early treatment is very important, no matter in conventional medicine or Chinese medicine, including acupuncture. So the first characteristics, identify the nature of the disease. Also, we need to identify the disease. In acupuncture treatments, we emphasize the meridian differentiation. When we study the differentiation methods, we didn't go through the meridian differentiation because the meridian differentiation is more related to the Zangfu organs as well as the distribution of these meridians. For example, the lung meridian. It travels from the middle jaw, goes to lower jaw until back to the upper jaw. It comes to the superficial from the arm and then to the hand. So if any diseases, any impairments happens in these areas, especially anterior parts of the median side of your arm, this can refer to the lung meridian. Because of the lung meridian links to the lung organ. So this patient, if a patient suffers from cough, loss of voice, fever, short of breath, chest pain, or chest oppress, coughing blood, running nose, sneezing, nose bleeding, sore throats. If a patient suffers from any of these diseases or any of these symptoms, we may refer to the lung, because the lung sits in the upper jaw in the chest, as well as the orifice of the lung in the nose. The throat is included in the lung system, so any symptoms that happen along the meridian or the organs, we will refer to this organ or this meridian. This is the meridian differentiation. That's why in the diagnostics, we didn't emphasize the meridian differentiation, because the meridian differentiation actually is aligned with the Zangfu differentiation as well as the distribution of the meridian. So in order to study the meridian differentiation, firstly you need to know the distributions of the meridian, where they travel, the pathways of the meridians, and then you need to understand the Zangfu differentiation method. Thirdly, the holistic concept. The holistic concepts, no matter in herbal medicine or acupuncture, we emphasize the holistic concept. This concept will help us to conclude the symptom, will help us to find the root causes of the diseases. Again, we use a similar example. A patient suffers from headache, red eye, sore throats. We may conclude that this patient suffers from liver fire. If the patient presents as the ulcer on the tongue, the scanty urine, then we can conclude that this is something related to the heart and the small intestine, especially the heart fire or the heat in the small intestine, collapse of anus or uterus. These are all due to deficiency of middle jiao, the qi deficiency of middle jiao. So in the treatment, we're going to focus on the middle jiao. We don't only focus on the anus. So from this point of view, we need to apply the holistic concept in our treatments. A patient suffers from headache. We don't only focus on the head. In future, you will see sometimes the patient suffers from headache, especially in the acute stage. We may insert the needle in the foot. We choose the distant points to relieve the pain in the head, the headache. So these are the application of holistic concept. We also need to distinguish manifestations and the root causes. Urgent, which one is urgent and which one is not urgent. This will help you to decide which aspects you want to focus. This will answer our first question. A patient comes to you with flu, all flu symptoms, hypertension, and diabetes. Which one do you want to focus? The patient suffers from severe cough and slightly high blood pressure and slightly high blood sugar. In this situation, we need to treat the cough first. It's not the hypertension, not the diabetes, because this is the acute, more severe, dominant symptoms. Urgent, compared with the blood pressure, urgent. In the other situation, another patient comes to you with similar symptoms. Runny nose, sneezing, cough, sore throats, headache. So the patient got common flu symptoms. And then when the patient comes to you, during your fecal examinations, when you check the blood pressure is 190 over 120. In this situation, you need to reduce the blood pressure first before you move on the common cold symptoms. So we need to distinguish what's urgent and what's not urgent. Our treatments need to focus on something urgent as well as the manifestation and the root causes. There's no rule that say you have to focus on the root causes or you have to focus on the manifestations. It all depends on individuals as well as the current situation. Lastly, we need to focus on individuals, the geography, and the time. So these are the three aspects in Chinese medicine that we need to focus: individuals, geography, and the time. Different patients in the different body constitution. Geography differences. Someone lives in Joburg, someone lives in Durban, and someone lives in Cape Town. Different geography may result in different conditions. In the time, the patient comes to you with joint pain. In future, we will know that we call it B syndrome. With joint pain, the patient comes to you in spring or in winter and in summer. We may apply different treatments. Especially, we may apply different needling techniques. As this is the injection from 黄帝内经. It described that in spring and summer, we can have shallow insertion and we can use less Moxibustion. In autumn and winter, we can have deep insertion and keep longer, and then we can apply Moxibustion. This also due to the changes of the yin and yang of the nature. This is also due to the changes of yin and yang in nature. From spring to summer, temperature is increasing. When the temperature is increasing, the yang qi is increasing. So the yang qi increasing, the diseases or the qi of the human body will move to superficial. At this stage, we can have shallow insertion to regulate the qi in the superficial level. Because the yang qi is increasing, so we don't have to use a lot of Moxibustion. But in autumn and in winter, the temperature is declining. The weather becomes colder and colder. In this situation, the yin qi is increasing. The yin qi is increasing, the qi of the body also will move internally. See here, the movement of qi of the body actually align with the nature. Superficial is yang, internal is yin. When the yin qi increase, the yin qi of the body will move internally. So our treatments, we can have deep insertion. We can keep longer. We also can apply Moxibustion to relieve the yin pathogen. So these are some key characteristics that we need to think about before performing the treatments. In this video, we mainly discuss the key characteristics of acupuncture and Moxibustion, more specifically, the clinical application, the key characteristics in the clinical application, what aspects we need to focus on in your practice. From the next video, we're going to discuss the application of the 8 principles. Thank you for your attention.